And let's talk about addiction and experiences that have to do with addiction. It is Monday evening, close to 8 o'clock. So I'm not sure if anybody will be tuning in, but those who didn't, they can listen to this video later. I have worked in addiction for a very long time as a nurse, and also worked in areas related to addiction in health, mental health, as well as in public health settings. And I just thought that this is one of those topics that it's kind of good to talk about. If anybody's tuning in, if they have any questions, I would be happy to answer as well to the best of my knowledge and ability. Addiction can be a very stigmatized area. Tree Climber One, thank you for joining. I have a lot of experience as a nurse, as a public health professional in addiction, and also had people dealing with addiction in my family. So I just kind of thought I wanted to have a discussion. If you have any question or any specific areas you want to share about or you want to talk about, please let me know. For me, addiction first touched my life when I was really young. I was 10-year old, and a really dear family member who was my uncle was 10 years older to me. He was like a big brother. He died in a car accident that was related to drinking alcohol. And that changed the whole family. It changed me. It changed my mom, his twin brother. My grandmother could never forget, of course, his son died because of this accident related to alcohol and drinking. And unknowingly, I think that kind of planted a seed in me that later in life I became a nurse who had worked with addiction for a very long time. And actually, I just finished a job that also was working with addiction for the last 3.5 years. And previously, I also worked about a decade in addiction or addiction-related areas, both in treatment and in hospital and outpatient settings. So it had touched my life a lot. And I think there's a lot of stigma about it and a lot of misconceptions that people might pick that they want to be an addict, or if they could just make this decision or that decision. It is not that easy. Once you're in the depth of addiction, from what I have seen, to get out of it. Many people hit rock bottom or try treatment and different community setting support of groups and outpatient clinics multiple times. There could be people who are successful after the first time, but there are also people who have hit these treatments and outpatient clinic multiple times before they are successful. And it breaks my heart. Honestly, I have seen so many families struggle. And yes, there might be some people who you could say pick addiction, but I don't necessarily think that anybody picks to be an addict. Hi, Patricia. Thank you so much for joining. Just talking about experiences I have had as a nurse and as a person with family members who are dealing with addiction. If you have any questions or want to share anything, please let me know. Write it in a message. And thank you so much for joining. So as I was saying, I had seen so many people whose life have been changed and family members' life have been changed because of addiction. And of course, the most horrible thing happens with addiction, that is somebody dies. There's a book I have written, which was the first book that I have written I started in 2013 and finished 2019, when I interviewed about 50 or a little over than 50 people, people who dealt with addiction, before succeeded or not, family members, nurses, social workers, doctors, nutritionists, and different kind of professionals, even mothers, grandmothers, or friends who went through this kind of process with somebody or have seen people who are dealing with addiction. And I can honestly say, before I understood addiction, I had a lot of biases myself because it's so easy to tune into that stereotype, right? But when you understand that there's some people literally almost did not have a choice, that is what truly, truly breaks my heart. Because when somebody is in the in-depth of addiction so much that they get another person addict, and that person is a child, that was extremely hard to hear. It was extremely hard to see and understand in the beginning. Gabor Mate has a great book also, The Realm of the Hungry Ghosts. And in that, he tells a story of a young girl who goes and searches for her mother. And her mother is an addict, and they have a great connection. And then, unfortunately, the mom hooks her daughter on substances as well and sells her to get the next fix. And what can be difficult for people to understand is that when somebody is in that much depth into addiction, that's all they see. That's all they see. They are in a lot of pain. It could be emotional, it could be physical. And all they might be able to focus on is the next fix. And it's not necessarily anything that they can control when you're in so much in depth. What I have seen is people are so lost that it's really difficult to get out of it. And many times, as I mentioned before, people unfortunately have to hit the rock bottom or have to have like some really good reason why they stop addiction and seek treatment. Don, thank you so much for joining. We're just talking about different experiences from addiction that I had as a person who know people in family and friends who were dealing with addiction, also as a healthcare professional. If you have any question, any experience, anything, please write it in the message, and I'm happy to address it as best as I can, or share your experience with others. One of the most difficult things I have seen is the family not necessarily knowing what to do when they have somebody that is an addict, and the loss of people who be struggling with addiction really touched my heart. And the first time when I got out of addiction nursing, it was because of that, because I felt like it broke my heart every day when I see all the struggle. And I have done hospital nursing and detoxing a long time, also stabilizing pregnant women who were in methadone. And there were a lot of questions about how can somebody be pregnant and be on methadone or be an addict. And what people didn't understood that these women, unfortunately, were hooked on addiction before they become pregnant. But the pregnancy many times gave them a chance to get sober and get into treatment to help their child and to be able to keep their child. Charles, thank you so much for joining. Talking about addiction experiences that I had as a nurse, public health professional, as also a family member, and I had friends who had dealt with addiction. Patricia, forgive me for leaving early. I am 44 years sober, wonderful, a psychotherapist in private practice for 30 years. I have worked extensively with addicts and alcoholics. Good luck. Thank you so much, for Patricia, for sharing. And congratulations on your sobriety. It's really wonderful. If you wanted to check out later what we talked about, it's going to be posted on Substack, also on my YouTube channel. And I'm very grateful for all the work that you're doing as a psychotherapist and having a private practice for 30 years. That is amazing. And I can't express enough how high the need is for that kind of service. So I really, really appreciate you, Patricia, because one thing that I have seen as a nurse is that it is so difficult to get treatment and get healthcare professionals who can help you and support you. And unfortunately, even if people get into treatment, sometimes people leave early, or the first treatment or the second or the therapy session, they leave and it might not stick. So it is really wonderful when we have more providers and more availability for people to be able to do those type of services. So thank you so much for doing that, Patricia. Thank you for joining as long as you can. And we can have future conversations. And, if anybody want to have a personal discussion or a life together later, we can also do that. So just let me know, send me a message, dancingelephantpress@gmail.com, or write a comment in the Substack comments or on YouTube. And I'm happy to connect and collaborate about this topic or any other topic in the future. Does anybody have any questions or any other comments besides Patricia about addiction or the different type of addiction, or any personal experiences that you would like to say? Please send it in the message. I appreciate it really much. So the difficulties that I have seen in the treatment setting is the price of the treatment. So I have seen families going broke, and families struggling to try to get people into treatment. Many times when somebody is in the addiction and they make the decision, okay, I want to get sober now, we want to try to get them in as soon as possible, because you want to snatch that mindset before it goes into the craving again, and the thought that, no, I might not be able to do this. So what happens in the brain when addiction kicks in? It is a pattern that people get used to. Just the same thing, this is a really simple explanation, but the same thing if somebody have dinner at 6, and every time they have dinner at 6, or breakfast at 8, or they have, cereal with milk. People who are in depth of addiction, it is normal for them to have that beer, to have that heroin, to have that fentanyl, to have the cigarette or the weed or whatever it is exactly. And I know that there's a divide, could be in a community, of people who drink alcohol and people who use opiates or other type of substances. To me, when I look at anybody who is dealing with any kind of suffering like addiction, they're just a human being in trouble, and we need to try to help them as much as possible. Is it always possible? No, circumstances might not allow that. Does it always work? No. I know people who struggle and they stop talking to family members, and family members got hurt, got hit, police gets involved, people get into jail, people hurt other people for getting money, stealing, all kinds of things that could be related to addiction. Addiction can sneak up on people. It can start really simple, just one drink a day, and then it becomes a drink every day. Then it can become 2 drinks, 3 drinks, 4 drinks, and more. And before they know, they become an alcoholic. Some people, the pain, the sorrow that happens with a loss of people, trauma, that happens. I love our military from my heart, have family members in the military, and many times military servicemen and servicewomen see and go through such an amazing trauma. that they put their sorrow into addiction. And my heart breaks for them. And I really hope that many people who are in serving our country are able to get through their addiction and have meaningful lives. What can we do? Can we do anything to prevent addiction? I believe that teaching emotional coping skills from early childhood, since from as soon as the child can understand communication from the beginning, because there have been studies shown, for example, the ACE studies, that when there's childhood trauma, um, things can get more complicated in life later. If you start to be able to suit yourself as a child, even and have those coping skills, then you might not turn in towards something else that trying to numb the pain. I don't believe that anybody wants to be suffering with addiction. And I do believe that it is a disease, and part of it is the fast pace of society, the expectations of people, anxiety, depression, mental health issues, grief. There's so many things that can lead down on that road. And once the brain is hijacked, the different pathways for alcohol and opiates, and get used to that routine, it is really, really difficult to break. It can take a long time. Let's say a brain is depleted from dopamine, which is our happy hormone. So a person might be happy just to have, a beautiful, nice night, go out with friends and family, have a dinner, play cards, whatever it is, go out to the park, play ball with their children. And you get a little bit of dopamine that is released during that time. The same dopamine hits happen with addiction as well. And in the case of the alcohol, it's a different pathway because that's a suppressant, central nervous system suppressant. So in that case, it kind of has a numbing effect. The person can numb the pain that way. So either numbing the pain or increasing the happiness hormone. But what happens is that the happiness hormone, instead of, let's say, just a little bit of release, it gets a huge release. And when you keep getting big, big releases, it depletes. And then there's nothing more in the brain. And that's when the deep repression hits. And that's when people start to chase that same feeling that was there before, but it is not there anymore. And the brain can recover. That's the good news. So from opiates and alcohol, the brain can recover. It takes a long time. So it takes up to a year, or it could be more, when the brain fills up with dopamine again and people can start to experience joy just from simple things of life like we do every day. Now, there are some substances that actually literally eat the brain, and that might be more difficult to recover if not possible, depending on the severity of the damage. But what really scared me as a nurse when I went on a conference in Washington, in Marysville, one time, let's say maybe about 12 or 13 years ago. And I have actually seen a brain of somebody who used methamphetamines. And literally the brain was full of holes. And you might not be able to recover from that. It's pretty impossible. And I just felt terrified for those people who have that brain or going down on that route, that they might never, ever be able to be fully themselves again because of what had happened and what this drug has caused. We're not meant to have certain chemicals, in our bodies. They are eroding our bodies from the inside or from the outside. And I think it is terrifying to think that people get into so much pain and so much anxiety or depression or chasing something that may be unrealistic to take such a substances into their bodies to cause such a damage that is unrecoverable. I have seen people with that type of damage, and when I think of that, there's really no words. And of course, their families and friends are devastated, just like with anybody with addiction. I think there's a misconception out in both ends. There's a misconception of people who are in addiction thinking that nobody cares about them. I care. And I'm not the only one. There's millions of people out there who I know work in healthcare who care. There's family who care, even though the connections might be stranded. If a person able to get sober, they take them back. They'll take you back. Families, friends, we forgive, we forget, we understand. If you're anybody out there who's struggling in addiction, I'm sorry that you are where you are for whatever happened in your life, but just do know that there is help out there. There's good people in the field who work and try to get you better. So if it's a 1-800 number that you call or show up at a local mental health place or whatever it is, call a friend, a family. I can list some support lines in the chat after this. The best way to get sober, if, of course, people make that decision voluntarily. Some people might not be able to make that decision voluntarily because they commit a crime and then they end up in jail, which is horrible. Nobody wants to see their friends, family in jail, right? Involuntary detoxification and treatment can also work. Not the best way to do it, right? But I have known people who ended up in jail and become sober, and that was their wake-up call and have never used again. I have also known people, of course, who went to treatment and able to stay sober. I also know people who got sober. They were sober for 20 years and something happened and they relapsed. And they drink themselves to death, or they use too much and they have OD'd and died. Of course, now we have things like naloxone that can help save people with opiate overdose. The problem is fentanyl. There's so many things are now laced with fentanyl. Even marijuana weed can be laced with fentanyl or anything else. And a little bit of fentanyl can just stop somebody's heart. And that is so scary. And I did know, I talked to a grandmother in the book. This story is described that I wrote, is her granddaughter got hooked on pills after having a very difficult C-section. And the doctor only gave so many medications, and she was still in pain and got some medication on the street. And she didn't know testing was not widely available then. The fentanyl test strips, now they are available. Then it was not available. And she did not know that the pill that she has taken was laced with fentanyl. And she died, and she left a baby behind. And I am certain if she would have known that she would die from that pill, she would have not taken that pill. But especially when something is purchased from the streets, nobody knows what exactly is in it. And there's different mixes and things come out all the time. And whenever something new comes out, I'm just terrified to hear what kind of horrors it does to the human body. The newest thing that's out there causing great wounds on people's bodies that are extremely difficult to heal and can cause infections. I have seen and helped treat many wounds and wounds that needed to be debrided by a provider, wounds that needed months of antibiotic treatments. People had infection that went into their heart and get endocarditis because of an infection, infections in the buttocks, in the arms, using up veins so bad that for life-saving events, we cannot find a vein besides in somebody's neck or chest. I cannot even tell you all the experiences, of course, which is over a decade. But I really appreciate people coming and just listening to some of my experiences. If anybody have any questions, I really appreciate Patricia checking in. I'm happy to answer now or later if I can. And there might be more sessions later that I talk about addiction, especially if somebody has a specific question or a specific area that they want to talk about. It's something that's really close to my heart because I have experiences in my family as well, and close friends and their children or other family members, fathers, mothers have been affected by addiction. I just want to say the last thing about alcohol. Alcohol is one of the most difficult ones because it is widely available everywhere. You can go into any store and purchase alcohol. And people have wines with dinner. If you're a person who is able to have a little bit of wine or a beer occasionally for an occasion, go ahead. I don't drink because I don't believe that something like drinking is good, because alcohol is a carcinogenic in your body. It transforms into one. But occasionally, if you want to celebrate and have a drink, okay. But if you ever had any experience or have a family history or have a genetic makeup that make you susceptible to alcoholism, because there is a gene for that, I have it. Just don't touch the thing. It's not worth it to go down that route to by any chance be affected by it. It is easier to not use something than use it, get into a habit, and then stop using it. Another really typical thing that we all have around is food, right? So it's really easy to get addicted to food. And for those people who don't know, bread and cheese, and unfortunately chocolate, is the same pathway as opiates. It gives you the pleasure, the opiate, the dopamine release when you eat it. So with that, to moderation or abstinence, they have good benefits, especially chocolate. Dark chocolate, the bitter chocolate, has a good benefit. The sweet chocolate really don't, especially if there's not even enough cocoa bean in it. It's really easy to get addicted to things that are chipses and different type of breads and sweets and things like that in the store too. It's recommended to walk around the store where there's the produce and not even go into the aisles where all those things are present, and the candies and the different things that are really high sugar. And I know that it's a different category than when you look at drugs and alcohol and those substances, but it also kills people. We have an epidemic of obesity, and we also have an epidemic of heart disease and diabetes. Sometimes when people stop smoking, they start to eat candy. Or when they stop weed, they're looking for something sweet. Make sure it's a sugar-free one that does not contain sugar or alcohol sugar either. And try to go to things that are healthy. Chew on cinnamon sticks or carrots or something like that. Hi, Ashley. Thank you so much for joining. Just talking about different addiction experiences. If you have any experience, or if you know somebody who has, or you want to share anything, please do. I've been just talking about experiences as a family member, as a friend, and also somebody who I who been in nursing with addiction for a long time, and also worked on it in public health and in the community. So I appreciate you joining. If you want to share anything, please let me know, or if you have a specific question. I was just talking about different type of addictions and what it does to the brain, and what are the things we could possibly do not to get into the addiction, and what are the things that we can do to um, stop it once we are there. It is not easy, and honestly, I had a misconception too before I started to work in addiction, and I was biased toward people as well, because when you just walk the streets and you see somebody who is out on the street and maybe they are drunk or using needles or high, you don't know what their backstory is. Mm. One of the most heartbreaking backstory is that I heard. I shared a similar story in the beginning, but there was a woman who told me once that it was their aunt who started them on drugs. Um, the mom was not in the picture, and the aunt started to give alcohol and drugs to this child when she was 6 years old. And when I started to hear stories like that, then I understood that there's some people, what kind of chance did they ever even have of not to get into that life if from a young age they were groomed into that life? Of course, we all make different choices throughout the life. All I have seen is a lot of suffering in that. Okay, Ashley saying, I have never dealt with any kind of addiction, but let's see. What else is coming after that? I feel like there's a story there, Ashley. Maybe you know somebody who have. The hardest thing for me is having friends who are dealing with that in their families. And there's so many people who does. I currently have friends and family members who know somebody or themselves or their family member dealing with it. A few friends who just didn't want the help. It is really difficult. Many times, people have to hit rock bottom. Something have to go wrong. They get close to losing their life, losing their family, losing all the money. There's just sometimes, unfortunately, people have to have like a really traumatic life experience to get out of the addiction. what type of things your friends are dealing with, Ashley? Is it alcohol or drugs? Or if you want to share, you don't have to, but if you want to. Um, Many times there is some kind of trauma behind it. Also, like people try to hide something or run away from something, and that is why they might be using the alcohol and drugs. Well, yeah, it is just difficult, especially if you are the friend, to see your friends struggle from the addiction, and just make sure to have boundaries because, things can get complicated. I know people who were stolen from, robbed of money or jewelry, their cars were taken. Um, and you can also physically get hurt. It also depending on how deep your friends are in the addiction. So you want to make sure that you're protecting yourself, which can be really difficult when you care for somebody, but you have to make sure that you stay safe, Ashley. Okay. Also, treatment is not cheap. And it takes a lot of work to go to have therapy. Um, Patricia was here earlier, and she's a therapist, um, and she's been sober 44 years, and she's been doing therapy for 30 years. And it was really great for me to hear that because we just need wonderful therapists out there and treatment centers who are focusing on the person, not on how much money they bring in. And that is rare. Unfortunately, treatment is very expensive. Some people are able to do treatment at home, um, what we call like a walking detox. If you have a provider and a clinic, they might be able to give you some medications to detox off of whatever you're in. Oh, oh, Ashley, those are the stories that break my heart. Ashley says, I just lost my mom in a horrible tragedy where he was so drunk that my mom didn't make it the first 48 hours. That is heartbreaking. It's heartbreaking when other people get hurt. I lost my uncle when I was 10 and he was 19 to an alcohol related car accident. And it is extremely painful when I'm so sorry about your mom, Ashley. It is very painful when we lose somebody because somebody else done something that they should have not. And they might be in a state that they're not even realizing what are the harm they are doing to another human being. They are not capable because they are not fully with it, especially like in this case, this person was too drunk. Thank you so much for joining. Um, I'm not sure how to exactly say your name, so if I butcher your name, please forgive me. Bibila Ramarao. Um, Sorry if I'm not saying that right, but thank you so much for joining. We are talking about addictions, how people's life might have been affected by addictions. Ashley, I hear you. I hear you from the bottom of my heart that you try to make sense of it. And it's really difficult to try to make sense of when you lose your mom to a tragedy because of somebody was drunk. There's no words um, that one can say that could relieve that pain. If you know the person who was drunk and you know their stories, that might be able to help, to make some sense of it. Many times, unfortunately, people under the influence, they don't know how much harm they cause to other people and take away people who we love. And that's how I felt about my uncle too, because he was not the one driving the car. And with the accident, he flew out of the car and he didn't make it. And our family never recovered fully from that. How you recover from losing a 19-year-old young boy. Oh. So Ashley says he lost my mom's life and he barely had a single scratch on him. That is extremely difficult, Ashley. Um, I hope that you're able to talk to somebody about this, as you were saying that it's difficult to make any sense of it. Some things, it's really hard for us to make sense of it. It's just with time, the pain can lessen and we can try to focus on the good things that we remember about the person. It's not easy. And grief is really difficult and it's cyclical. It's not like you can get over it in 3 days, which is the days that normally people say, okay, you can have 3 days and then grieve and then go back to life. It doesn't work like that. Ashley says, my mom is my life. Thank you so much for sharing, Ashley, and sending you love and healing. And I'm really, really sorry that you have to go through this. A daughter losing a mom losing a daughter or son, it's to a tragedy like this. It's horrible. It's painful. It's numbing. Sometimes it can help if you talk about it, if you have people, support group, family, friend, therapist, write it down in a journal. It can be especially difficult if you know the person who caused the harm and they don't feel any sorrow. I have seen that too. I have also seen the deep pain when people realize what kind of harm they have caused to somebody. And I don't know if this person have any remorse. I hope they do. I hope they do, Ashley. That is the ultimate pain, right? When somebody harms another person so much that they lose their life. No words for that. Just a very deep sorrow. And I feel your pain and I feel your hurt. And I'm so sorry that you have to go through this. Probably that person didn't know what they're doing, but it's still not an excuse. It doesn't necessarily give or restore a calm to our soul. I just hope that one day you would be able to not necessarily move past it, but that it will hurt less. I'm so grateful that my mom is still here. I can't imagine my life without her. And I know that there's going to be a day when she's not going to be here. And I can't imagine if somebody would hurt her, how I would deal with that. I would need a lot of support and help and a lot of calming and grounding activity in my life. And I hope you have that, Ashley. Okay. That's great. Oh, that is so great to hear that, Ashley. So Ashley writes, life has definitely changed me, but she has an Ashley's Angels Forever advocacy and support group since 1996. Talking about everything is helping me tremendously. That is so wonderful. Um, Definitely when this is posted on Substack on YouTube, you can write, in the comments about your group. And if you want to share, um, then you can add that support, for other people. Lisa Joy and I speak to. That's good. I'm glad that you have people around you that you can talk to. So now what Ashley is describing is the pain on the other side, that when a tragedy hits, when somebody who is an addict hurts somebody else, and she's a family member obviously suffering from the loss of her mom, as I have also an experience of losing my uncle who was like my brother to me when I was 10. And it just takes such a long time to go over that. I'm glad to hear, Ashley, that you guys are able to talk. You're able to talk and have that support. It is really important in our lives to have people. We are tribal people. We're meant to be in communities and supporting each other. So it is really wonderful when you have people who you can turn to and have those conversations when you need them. And I'm just deeply honored, Ashley, that you have shared this with me. Thank you so much. I understand this. This is difficult and deeply personal to share. So I really appreciate you coming on and sharing. Thank you so much. Does anybody have any questions about anything that we've been talking about? I think we're getting close to an hour, and I know it's late at night. So I just wanted to check in if anybody have a question before we close up. More tragedy. Ashley is saying that her son was murdered 32 years ago, and we have to tell our survivor stories. Yes, we do. We have to talk about it. We have to share it. We have to write it down. We have to do what we can to help the healing process. And when we do that in community, that helps. It doesn't necessarily take all the pain away, but it helps when we are in community and we have that support of each other. And I am grateful that that's more out there now, because when my uncle died, it's 40 years ago, almost 41 years ago. And back then, nobody said anything about, that you should talk to somebody. I was crying myself to bed every night, and I was begging God and the universe and whoever is out there. And I was so angry at Yoshika, my uncle. Why did he leave? Where is he? I didn't understand as a child, especially if you're a child and something like happens. You don't understand what's going on. You just know that you love somebody and then they're in a coffin, but you still not necessarily get it, like that they are gone. Be blessed to exhale until the dust settles. Thank you, Ashley. And thank you so much for everybody who have joined today to talk about addiction. It's a very difficult topic. So if you have questions, or even if you just want to send an email to me or anything, dancingelephantpress@gmail.com. Or if you want to make comments after that this is posted, please do it. If you have any questions or a specific area that you want to talk about. Thank you so much for all of those who joined today. I really appreciate you. And keep safe and keep your loved ones safe, and have a beautiful night and the rest of your day. Take care. Gabriella signing off. Until I see you guys next time. Have a beautiful day. Bye-bye. Sounds wonderful, Ashley. Let's get together and continue to help anyone. Yeah, absolutely. Would be happy to do that. Take care. Bye-bye.